Erectile dysfunction (ED) is a common condition affecting men of all ages, with estimates suggesting that as many as 50% of men over the age of 40 experience erectile dysfunction to some degree. Erectile dysfunction refers to the inability to achieve or maintain an erection sufficient for sexual intercourse. While it can be a source of anxiety and frustration for many men, it is important to remember that erectile dysfunction is a treatable condition, and with the right help and support, most men can regain their sexual function. Etiology of erectile dysfunction. There are many factors that can contribute to erectile dysfunction, including both physical and psychological causes. Some of the most common physical causes of erectile dysfunction include cardiovascular disease, diabetes, high blood pressure, hormonal imbalances, and injury or damage to the pelvic area. Erectile dysfunction can also be caused by certain medications, such as antidepressants, antihistamines, and some blood pressure medications. Psychological causes of erectile dysfunction are also common and can include stress, anxiety, depression, and relationship problems. Performance anxiety and fear of failure can also contribute to erectile dysfunction, as can low self-esteem and body image issues. In some cases, erectile dysfunction may be a symptom of a deeper psychological problem, such as a lack of sexual desire or a history of sexual trauma. Diagnosis of erectile dysfunction. Diagnosing erectile dysfunction requires a thorough medical evaluation, including a review of the patient's medical history, physical examination, and laboratory tests. A urologist or a sexual health specialist is often the best medical professional to diagnose and treat erectile dysfunction. In some cases, further testing may be required, such as a penile duplex ultrasound, a penile nerve function test, or a nocturnal penile tumescence test. Treatment of erectile dysfunction. There are a number of treatment options available for erectile dysfunction, and the best course of treatment will depend on the underlying cause of the condition. For some men, lifestyle changes such as losing weight, quitting smoking, and reducing alcohol consumption can help improve erectile dysfunction symptoms. For others, medication may be necessary. Phosphodiesterase type 5 (PDE5) inhibitors are the most commonly prescribed medications for erectile dysfunction. These medications, such as sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, work by increasing blood flow to the penis, helping to achieve and maintain an erection. Other treatments for erectile dysfunction include vacuum constriction devices, penile injections, and penile prostheses. In some cases, surgery may be necessary to correct a physical cause of erectile dysfunction, such as a venous leak or Peyronie's disease. In addition to medical treatments, psychological and couples therapy can also be effective in treating erectile dysfunction. Talking to a therapist about the emotional and psychological aspects of the condition can help men come to terms with their feelings and improve their sexual function. Couples therapy can also help address relationship problems that may be contributing to erectile dysfunction. Prevention of erectile dysfunction. There are several steps that men can take to reduce their risk of developing erectile dysfunction, including maintaining a healthy lifestyle, including a balanced diet and regular exercise. Quitting smoking and reducing alcohol consumption. Managing stress and anxiety. Treating any underlying medical conditions, such as diabetes and heart disease. Using a penis health cream, such as Man 1 Man Oil, to keep the skin and nerve tissue of the penis healthy and well nourished. Conclusion. Erectile dysfunction is a common condition that affects millions of men, but it is also a treatable condition.